Jean Van Smith, Director of Government Relations for Florida Hospital's Central Division. We're a not-for-profit healthcare system, and in Florida we have 23 hospitals, including Florida Hospital Kissimmee. And I want to talk to you about the effect that we've seen in Florida under the Affordable Care Act the last few years. Since the Affordable Care Act went into effect, we've seen a significant drop in the rates of uninsured, both in the U.S. and in Florida, which Congressman Soto talked about. Before it went into effect, almost 16% of people in the United States were uninsured. Since it's gone into effect, the most recent numbers are about 9% people are uninsured, which is a significant drop. More than half of the people who gained coverage did so under Medicaid expansion in the majority of the states which chose to do that. In Florida, we have a higher rate of uninsured than the national average. And before the Affordable Care Act went into effect, 1 in 5 people in Florida didn't have access to any form of insurance. So 20% of people were uninsured. Since the Affordable Care Act passed, our numbers have dropped to only 13.3% uninsured, which is still very high. And we managed to achieve that drop even though Florida chose not to expand Medicaid. If Florida chose to expand Medicaid, we could cover an almost additional 1 million people in Florida, bringing our uninsured rate even lower. The majority of people who gained coverage in Florida over the last 5 years did so through subsidies, through the federal exchange. And we're very concerned about the Affordable Care Act going away because over 1.5 million people would lose their subsidies if that was the case, and most of them would not be able to afford insurance otherwise. What this has meant for hospitals is that under federal law, we're required to treat any patients that show up at our facilities regardless of their ability to pay. And we want to do that because we want people to be healthy and to have access to care. So we will always treat everyone who shows up at our doors whether or not they have insurance. With more people coming in who do have insurance, that means that we have more money to invest in community programs, more points of access of care, and newer and better medical technology. So here in Kissimmee, most of you may have seen that over the last couple years we expanded at Florida Hospital Kissimmee. We built a new tower here and we opened up a diagnostic cath center. And as a not-for-profit hospital, we take any extra money that we have and we invest it back into the community. In 2015, we gave almost $1 billion in community investment, either to uninsured, underinsured, or community programs. If the Affordable Care Act goes away and the rates of uninsured people go even higher, unfortunately, we wouldn't have as much money to invest back into the community. So thank you again for letting us speak today.